Hi guys, this is Dr. Talin Pepper, Dr. Pepper Physical Therapy. In this video, we're going to talk a little bit about sit to stand training and getting up. So this is still reviewing things about our hernia repair. And so when you have a hernia repair, getting up and down from chairs can be a little bit difficult, just like it is with any type of surgery that you have on your knee or hip or ankle or anything like that. So we're going to talk a little bit about how to get up out of the chair and not strain your abdominal cavity, because that's what's happened. Like you have this wound essentially to your abs, to that abdominal wall and down the pelvic floor. Then when you try to get up and you strain to get up out of a chair, that's a little bit difficult to do. And so we're going to talk about how to get up out of a chair. We'll look at a chair first, and then we'll talk also about like a recliner and what's a better position to get in and out of. So, okay, the first thing I want to do, let's set up over here. Let's look at the chair position. So I've got my chair set up, and one of the things, again, I'm still pretty fresh. I still have soreness in here in the abdominals, but it's moving around pretty good. But when you're going to go get out of a chair, it's that forward bend, that tightening that you're trying to do to almost like an abdominal crunch when you go to sit up out of the chair, and that causes strain to the abdominal wall. And so one of the things I want to look at first off is you're going to want to use your hands some, right? So I found that using your upper body to help to shift you around a little bit, because if you're trying to use your body to strain and shift forward, what you want to do is make sure you're using those hands to put pressure. So if we get back into the chair and you get relaxed into this position here, if we're going to try to stand up, first off you want to brace a little bit. I would say, okay, let's make sure we kind of tighten in a little bit here to kind of support that abdomen right there. And then what I would say is maybe use one hand to kind of put pressure here, or put a pillow across here, and then your other hand to on the chair or on the armrest, or if you're in a recliner, on the edge of the arm to kind of just help support you, or a belt. So in our part of our kit, you could get a belt around the leg, or put a tie where you can use something to pull up this direction. But for now, we're going to use the arm here. So you're going to use that to push you forward. So you use your triceps to try to lean you forward. That way we get that pressure off that abdominal wall. So now that we're up, it's a lot easier to be here in this position. Then let's look at using the hands to scoot you forward. So you want to get close to the front of that seat, because the further you are in the back of the seat, it's much harder to get out of. So you're going to get right close to the front of that chair. Okay, and then once you get up to the front, you're used to kind of the whole nose over toes situation. You want those feet to be back, and then you're going to go ahead and stand up. So you're going to lean forward, and again, you may have to kind of put a little pressure here on that abdomen, because it's sore to go forward this far. So either you go here, or you kind of got to go more vertical. But I'd say if it's a left-sided, this is what I find is if it depends on the side of injury, the side of the repair, that's the more sore side. So for me, it's the left. And so you want to take a little pressure off that left side. So you're going to be using your right side to assist you more with that. So we got a little pressure here on the abdomen. We're going over to that side just a little bit, using that right side to help us come up. And then once we get up standing, it's a lot easier to get up into this position. Then you're good once you get going, okay? And maybe a little tight once you first stand up, because when you first get up in that upright position, things kind of tighten up. So just kind of pause there for a second, breathe, make sure things are feeling all right as you get up into standing, and then kind of go about and start walking again. Okay, so it makes sense. So we've got and it's just the reverse when you come to sit back down, right? So you're going to sit back down. We're kind of reaching down, support that abdomen, coming down, nice and easy, and then you use your hands to help you shift back into the seat. That way your back can get supported, and we kind of brace and support that as we come back down to lean into the chair. All right, so there we go. That's how to get up out of a chair. All right, thanks for watching.